So Shelly, tell us a little bit about your journey.
My journey started in July of 2024. I did a breast exam. There was nothing there one day. The very next day I did another, just kind of randomly checking while I was in the bathtub, and I found a lump the size a little smaller than a ping pong ball. And I knew it was my lymph node. Being a nurse, I was like, oh, well, I'll get it looked at, but just kind of blew it off, thinking it was like just a little infection. Didn't feel anything in my breasts. I was lucky because I had multiple medical appointments for like my prescriptions already. So got right away with a mammogram, a diagnostic mammogram, a diagnostic biopsy. They couldn't find anything in my breast originally, just the lymph node, so they didn't know where the primary site was. Then they did eventually find it, and it was a very tiny spot, real lateral on the side, and they said, had it not gone into the lymph node, they probably would not have caught it. Mm-hmm. So even with mammograms, you need to check and be aware of your body because changes happen not just in your breast tissue. So I was diagnosed with stage 3 invasive carcinoma of the breast and with a HERS2 positive, which is a protein that makes a cancer be an aggressive cancer. It like feeds into the cancer. So that started my journey. Overnight, boom. I have no cancer in my family, my mom and my dad and stuff. So it was quite a surprise. I figured dementia would fit in far first before cancer, but I was lucky. I got in, got right away, got treated, got seen by a surgeon, got seen by the oncologist. By September 1st, I was receiving my port, got my chemotherapy started, and I responded really, really well. It was like after my first chemo treatment, that lump totally went down half in size. My oncologist was like, this is amazing. I was one of the lucky ones that didn't have a lot of side effects. So my journey was somewhat okay. I would never want to do it again, but in some senses I would because it changed so many things in my family aspect, in my personal life, in how I approach work. It's just like all of a sudden, kind of like my shirt, you gotta love yourself. Mm-hmm. And sometimes you have to put yourself first, which is hard. I went through 6 months of the aggressive chemo, and then the last 6 months I went through the targeting drugs, which the targeting drugs caused lots of diarrhea, but my body adjusted to it, and I'm done. September 17th, I was done with my last treatment. Mm-hmm. A week later, I got to get my port out, so I have no follow-ups for another 3 months, and I'm just trying to adjust. I'm really lucky to have met Brooke and Angie and Montana Maid. I was going to PT in Billings. There's a special person there that has training with just PT, with cancer, all various kinds of cancer, and that's all she deals with, is PT with people that have cancer. I went to her several times and she was good. I wanted to come home, be more home in this area, and Brooke graciously took me on. And we just learned and explored things together. I mean, she did a lot of the same modalities that the PT in Billings did, the massage, the stretching, lots of stretching. I also had 11 lymph nodes taken out, so I have the possibility of lymphedema, which I've not experienced, knock on wood, yet. So everybody's journey is different. And I think how you approach it is real significant. And I just have to say thank you, because it made this part of my journey so much easier. It's a little bit hard to lay down and have no breasts and then have somebody massage them and work on it. Even though you're a professional and I'm a professional nurse, it brings up different feelings. Mm-hmm. You know, it's a body image thing and stuff. So I have to say the energy in the atmosphere was very healing, and I wouldn't trade it for anything. So she worked hard, shit. She worked too hard. She's like, oh yeah, one more. And I'm like, oh good, one more. No, one more sat. And I'm like, oh, really? You know, so.
I don't know. And we have the joy of working with Shelly for like so much more. I think it blossomed into more. We worked on her hip before going into hip surgery and after hip, but everything was happening at the same time. I mean, we were still working on your scars and you were still in treatment. So being able to work on you as a full body, really.
Overall, Montana made a huge difference in my life. And then the extra programs that they have that you can get into when you're done with your PT to continue to follow up. I was going to do that. I am still going to do that. I just got kind of situated going back to work. Thank you to Brooke and Angie and everybody for helping me to get to that position where I could do my job. Now it's, again, love yourself, work 3 12s, don't work 5, and then put other things ahead. You know, make sure that you can take care of yourself. And exercise is so important. It's so important for you emotionally, physically. I know there's days that I was feeling like really kind of sad, I don't want to come in, and then you come in here and this energy is so positive. You see the kids running around and just the excitement, and it was just the energy walking in and you walk out a whole different person. So I'm so glad you're part of my journey.
We're happy you are too, because you brought an energy too. After, you know, this has been a year.
It is,
just a year, and how your mentality has changed. And we all knew that we were going to get a positive response when you walked in too, and bring us all uplifted. And we just love having you and your family, and you sharing your story is huge as well, because it changed in a day.
And there's so many different routes that you can go with your story. I mean, a person can go in and have just a lumpectomy. A person can go in and have one mastectomy. One person can have a bilateral or both breasts removed. They can choose to have reconstructive surgery, or they can choose not to. I chose not to, just because I'd already had a breast reduction. I just felt more comfortable, and that's what I needed to do. And health-wise, it was my choice, and I don't regret it. I think it's good. I would say 50-50, I either wear my prosthetics or I don't. Sometimes people look at me and I'm like, oh, well, it's my journey. You know, most of the time at work, I never wear anything. I just got my lab coat, and it's honestly kind of freeing. And I have a lot of family and friends. Everybody supported me in my decision, which is huge, huge. Family support and love and support from my medical people. So in the end, I guess I really wouldn't change anything. You know, there was some trials, there were some tribulations, you know, but.
She's amazing. She's a hard worker, and get right back to work, because her life is caring for patients too.
Yeah, it was important to get back to work. I mean, that was, part of it was physically hard, but I needed it more emotionally, just to be back to work. And I see that with this facility and these ladies and gentlemen, is they love caring for people. They love seeing them progress and make changes, and they can see how that's going to impact their life. So kudos to you guys.
We love it.
Yep.